I'm Tasha Vogel. I am a second year nursing student at Ontario Tech University, and I'm going to be administering Anita Smith's moxifloxacin in environmental scan. So I'm going to go into my patient's room and I'm going to introduce myself. Hi, I'm Tasha Vogel. I'm a second year nursing student, and I'm just going to be checking your IV bag and your IV site. So when checking an IV site, we're going to be checking for phlebitis and infiltration. If it's infiltration, it's going to show signs of swelling, pallor, and it's going to be cool to the touch. If you see these signs, you're going to discontinue the IV and you're going to notify the physician. If it's phlebitis, it'll show signs of redness, swelling, and it's going to be warm to the touch, and you'll then apply a cool compress. So looking at her IV bag, I can see that it's normal saline. It's not expired, and it has about 800 milliliters left to be infused. The IV tubing is patent. There's no kinks, there's no air bubbles, and it's looking good. So now I'm going to go to the nursing station, and I'm going to do some critical thinking. So, the doctor's ordered moxifloxacin. Its functional class is an anti-infective. Chemical class is a fluoroquinolone. Its use is it's an acute bacterial sinusitis, acute bacterial exacerbation of chronic bronchitis, community-acquired pneumonia, mild to moderate, uncomplicated skin-to-skin structure infections, complicated intra-abdominal infections, including polymicrobial infections, complicated skin-to-skin infections. Its pharmacodynamics onset, onset via IV is unknown. Its peak is 1 to 3 hours. Duration is unknown. Contraindications is hypersensitivity to quinolones. Some adverse effects is that it can cause headaches, dizziness, fatigue, insomnia, seizures, increased cranial pressure, prolonged QT interval dysrhythmias, tachycardia, blurred vision, nausea, vomiting, diarrhea, pseudomembranous colitis, renal failure, rash, candiditis, vaginitis, tremor, tendon rupture, anaphylaxis, and Stevens-Johnson syndrome. So looking at the patient profile, her recent updated status is that her leukocytes are elevated. Her chest x-ray shows signs of consolidation in her left lower lobe. Her temperature is elevated and sputum is positive for the Streptococcus pneumoniae, which is what we're going to be giving that medication for. So now looking at the monogram, I'm going to check for the rate at which it needs to be infused, which is via 60 minutes, and then check the compatibility, and it's compatible with normal saline, which is what she has hanging in her room. So now I am going to start my rights. Okay, so right patient, Anita Smith, right drug, moxifloxacin, right amount, 400 milligrams, right route, IV, which is what I have in my bag. Right frequency is once daily. Right time is 9 o'clock this morning. The right site is her right basilic vein, and the right reason is we're going to be giving it for her Streptococcus pneumoniae. So now I'm going to do my drug calculations. I'm going to go back to my monogram. So to do, we're going to do the gravity first. So gravity is V over T times C. So V, which is my volume, I have a 250 milliliter bag. And my time is to be infused over 60 minutes. And my C, it is 10 drops. 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 so I get 41.6, but to make it divisible by 4, we're gonna round it down to 40 drops. And then in order to calculate how many drops I need in 15 minutes, we're going to divide this by 4, which gives me 10 drops per minute. So now I'm going to calculate if I was to use a pump, an IV pump. So I know that it is my bag, my concentration, my volume actually, which is 250 milliliters, and it'd be over an hour, and luckily it is to be infused over 60 minutes, so it would be 250 milliliters per hour if we were to be using an infusion pump. So now I'm going to go back and I'm going to check my MAR to make sure that it is signed by the night nurse, which we can see it has been signed. And we can also see that Anita has an allergy to penicillin. And now I'm going to be doing my second set of writes. So once again, my patient is Anita Smith. Anita Smith. My right drug is moxifloxacin. Moxifloxacin. Right dose is 400 milligrams. Right route is IV, and I have an IV bag. Right time is 9 o'clock this morning. Right frequency is once daily, and the right site will be her right basilic vein, and the right reason is for her streptococcus pneumoniae. So after doing that, I'm going to once again do my third set of writes. So right patient, Anita Smith, right drug, moxifloxacin, right dose, 400 milligrams, right route, IV, which is what I have, our IV bag. Right time is going to be at 9 o'clock this morning. Right frequency is once daily. The right site is her right basilic vein, and then the right reason is for her streptococcus pneumoniae. So now I'm going to be checking my my drug calculations again. So for gravity, it's V over T times C, which is what I got there. Her volume is 250 milliliters. The time is 60 minutes, and then the right drop rate is 10 drops per milliliter. So when I do that, I get 40, and to make it divisible by 4 so that it falls within the hour, so I can divide it up into 15-minute quarters. It's going to be divided by 4, which gives me 10 drops per minute. If I were to use an IV pump, it would be the total milliliters over an hour, which is what I have. So 250 milliliters over 60 minutes, which equals 250 milliliters over an hour. So now I'm going to write down some identifiable markers for when I enter my patient's room. So I'm going to write her name. So Anita Smith. Her date of birth is January 24th, 1967. Her UI number is 076794, and she has an allergy to penicillin. Oops, spelled that wrong. Penicillin. So I'm gonna collect my medicine bag, a alcohol swab, my drip chamber and tubing, my watch, and my identifiers. And now I'm going to go to my patient. So before entering my patient's room, I will do hand hygiene. I'm going to go see my patient. Hi, Anita Smith. My name is Natasha Bogle. I am a second year nursing student at Ontario Tech University, and I'm going to be administering your moxifloxacin for your onset of pneumonia. So I'm going to check her name. Can you give me your name and your date of birth? Okay. And then I'm going to check her unique identifier 0707679494. And then I see that you're allergic to penicillin. Is there any other allergies that I may not know of? Okay, thank you. Okay, so now I am going to open my bag. And I'm going to piggyback my IV bag. Okay, so next I am going to wipe down her port using an alcohol swab, making sure that I keep the port sterile. And I am going to grab the tubing. I'm going to clamp my tubing before I apply it onto my main line. And I'm going to unscrew this cap, making sure not to touch the inside so that it is sterile. And I'm going to attach it to my IV. Okay, so now I am going to black flow my solution so that there are no air bubbles. And then I'm going to clamp my tubing again. I'm then going to remove the lid, and I am then going to spike my medication. And I am then going to hang it above my IV bag. Okay, so now I am going to unclamp this line, and I'm going to regulate my drip flow on my medication. And so I calculated 10 drops every 15. So I got 10 drips per 15 seconds. So now I'm going to clean up. And then I'm going to ask Miss Anita Smith, is there anything else I can do for you? No? Okay, so here's your call bell. If you need anything, let me know, and I'll be right back. So now I'm going to document my stuff. So I delivered the amoxicillin, not amoxicillin, the moxifloxacin at 9 o'clock on November 24th. I also have to sign the patient profile signature. So today is the 27th of November, 2020. My name is my status is I am a student RN, and yeah.